I just want to say one quick thing. So there was a rally in front of Cornell Hospital, and it's interesting how last year the nurses were all heroes, right? And this year they're being treated like zeros. How dare they? They worked all last year without a vaccine. It was no problem. But suddenly, when there's no COVID around, right? Suddenly they can't. Now they can't work without a vaccine. Anyways, here's Jennifer. A hero. Let's give it a hand for a hero.
Hi everybody, thank you for listening, coming to hear us speak. My name is Jennifer, I'm a nurse. I've worked and lived in Queens, New York my whole life. I've been a nurse for 27 years. 26 of those years are emergency room experience. I came today, I came today to share information with you of my observations of what's going on, and also because we need to stand up for our medical freedom. So my observations from the past year was I have virtually seen no evidence of a pandemic since the summer of 2020. There have been no cases, or I don't want to say no, there have been very low to no cases of flu during this pandemic. People that have been vaccinated and have tested positive, people that have been vaccinated are coming up positive for COVID. So that means at best, they're ineffective. And the other thing, which is sad but true, and you can see me later, my little card here. Yeah, the VAERS death and injury results are off the chart. They're dangerous vaccines. They're leaky vaccines. I see people every time I go to work, young people, they're having heart problems, they're having clotting problems. They shouldn't be having these problems. These are healthy people. And no one's responsible for that.
No liability anywhere.
September 1st, 2021, the American Nurses Association urged the U.S. Department of Health and Human Services to declare the current and unsustainable nursing staffing shortage a national crisis. So the AMA is saying that there is a staffing crisis, and there is. So during a pandemic and a nursing staffing crisis, these hospitals are going to fire healthcare workers because we will not take a vaccine. That isn't even a vaccine, it's a jab. So it doesn't make any sense. What they're going to do is they're going to create a healthcare nightmare. When you go in, for whatever reason, if you were going to wait 2 or 3 hours on a normal day, you may not even get treated if they start firing people like they're planning to do. And you know what? They're going to say it's because of COVID. That's the plan. The other observation is the constant, non-stop propaganda, the incessant pushing of these experimental and dangerous shots. I can't turn on the TV for a second without getting like lambasted with these constant commercials. And then the giveaways, the incentives. You know, I'll give you $100, I don't know, for joints for jabs, like all this nonsense. And donuts, yeah, you name it, yeah. They're also pushing for expensive and dangerous treatments, remdesivir. And if you go back to remdesivir and you look it up, the people that are benefiting from that are people like Fauci and his cronies. There's a lot of things that don't make sense during this pandemic. Shutdowns. They hurt the economy, they hurt the middle class, they hurt small business owners. That isn't, no illness should warrant closing down an economy, ever. The other thing is people wearing masks. Okay, they don't do anything. They do not protect you from quote-unquote deadly viruses. They don't. They harbor bacteria. They lower your oxygen levels. And like, I forgot his name, but he said, we can't see people's smiles. They dehumanize us. That's what they're going for. The PCR tests are useless. That's by the CDC's information, not just mine. Yes, and Carrie Mullis, poor Carrie. May he rest in peace. We don't isolate and test healthy people, but that's what we're doing. Science has gone out the window. We are now treating symptomatic people with Tylenol and telling them to go home and then just come back if they get sicker. That's not how you treat illnesses. It's ridiculous.
Vitamin C!
Yes, I'm going to get to that. We are segregating people by vaxxed and unvaxxed status when it is known that these vaxes or shots, jabs, whatever you want to call them, toxics, they don't protect against COVID. They are preventing patients and residents from having visitors, dehumanizing them, creating loneliness. You have no one to advocate for you. A lot of the deaths are not COVID. I'm sure most of this crowd knows that. They've been classified as COVID, but they are everything but. And of course, the suppression of safe and cheap and effective preventatives and treatments. Ivermectin, if you mention that on Facebook, you'll be banned. Hydroxychloroquine, vitamin D, vitamin C, zinc, quercetin. Okay. I have a quote from Benjamin Franklin, and it says, "Those who would give up liberty for safety deserve neither." And I think we're there. I just want to say the last strain of this virus will be communism. That's where we're headed. We are free people. Get off your knees.
Well, it may not be communism, but it's definitely going to be fascism. In fact, some of us are wearing Stars of David. You know, when they sent the Jews to the concentration camps, they said it was for the safety of the German people because Jewish people are contagion. They spread disease. So just keep that in mind.